Yeah, you're on.
Okay, good deal. Hey, I would like to call to order. Oh yeah, let's do that. We'll do a quick roll call before we get started. We are having this meeting telephonically so that we do not impact anyone or not follow our own rules of social distancing. So roll call, if everybody will say who's on the line, please.
Rick. Jason. Mark.
Rick, Jason,
John. Jeff. Mark.
Mr. Taylor? Okay, good. Making sure that you were there. Great. So we have all of our aldermen on the line as well as our chief of police. So with that said, I would like to call to order the special meeting of the Mayor and Board of Aldermen. Could I have a motion to adopt the agenda? Thank you. All in favor? Any opposed? Ashley, can I have your agenda, as I do not have one down here? So the only order of business on our agenda today is the consideration of the governor's executive order number 1463 issued on March 24th, 2020, and the impact that this order has on our current city resolutions. As you know, the board has adopted 2 resolutions over the past 8 days that we feel very strongly are in place to protect our community from this pandemic, in hopes that in doing so quickly, we will allow our community to get back to normal as quickly as possible. We think it's the difference in a 2 to 4 week shutdown and an 8 to 12 week shutdown. So we have been very aggressive in the steps that we've taken, all based on a lot of thought and prayer and advice from many professionals. When I called this meeting earlier today, my thoughts were much different than they are at this moment. We had read the governor's order and believed that from our first reading that it was one that, and it does supersede the resolutions that we have in place, but we felt like they could not be, that ours would not be able to stay in place based on the language in the order. I have just gotten off the phone with the governor, and for the past 30 minutes we have spent going through and comparing the order of yesterday with the resolutions that this board has passed, and have come to the conclusion that all of our resolutions can stay in place. And I very much appreciate the governor's work in reaching out today and in working through to get to this point. I am going to ask our city attorney, Coach Millette, to go through the order to kind of explain some of what we find there and how that works with our resolutions.
The order was handed down yesterday, Executive Order number 1463, and it goes through the similar background that we've seen in both prior state orders, as well as a lot of the same history and adopted findings that the city's resolution, or 2 resolutions that we've asked to go through. When you get into the now therefores, it says, in response to the COVID-19 emergency and in accordance with the guidelines from the President, the CDC, and the Mississippi State Department of Health, and pursuant to Mississippi Code Section 331511C4. And before I read the specifics, that's the section that gives the governor's office the power to pass laws, and that local subdivisions laws shouldn't be or may not be inconsistent with those orders. A says, from the date of this executive order until April 17, 2020, which is beyond the 15 days of each of our orders, although we'll have a chance to meet again if the mayor and board decide ours need to be extended. Mississippi residents shall avoid social and other non-essential gatherings in groups of more than 10 people, where the gatherings in a single space at the same time where individuals are in close proximity to each other. This does not apply to normal operations of locations like airports, medical and healthcare facilities, retail shopping, including grocery and department stores, offices, factories, and other manufacturing facilities, or any essential business or operations determined by and identified below. And I'll get to that in a minute, because I think we better understand this order as defining those essential operations. And Those will be, I think, a few differences in some of those essential business that are defined. Those may be different than a few of ours, but really not very much different as we found as we've gone side by side. 1B says, from the date of this executive order until April 17, 2020, restaurants, bars, or other dining establishments shall suspend dine-in services unless able to reduce capacity to allow no more than 10 people to be gathered in a single space at the same time, where individuals are seated or otherwise in close proximity to each other. However, the use of drive-through, carry-out, or delivery options is allowed and highly encouraged. And again, when I get to the essential infrastructure or businesses or operations, I'm going to talk about how they specifically address restaurants and bars and what we now understand are the options that cities like Oxford have taken. C, from the date of this executive order until April 17, 2020, persons shall not visit hospitals, nursing homes, and retirement and long-term care facilities unless to provide critical assistance, to visit residents receiving imminent end-of-life care, or as otherwise directed by the health care facility, provided in the professional opinion of the supervising physician or other supervising healthcare professional at such facility, that such visits can be accomplished without unreasonable risk to staff or other residents of such facilities. In lieu of in-person visits, electronic visits are encouraged. Before I leave that section, we don't think those are inconsistent with our resolutions now in place. Then response number 2 is consistent with Executive Order number 1458 earlier issued by the government, providing that essential employees of governmental entities should work from home to the extent feasible in order to minimize the interaction and risk of possible transmission of COVID-19 between employees. It is also recommended and encouraged that all Mississippi businesses and nonprofit entities likewise utilize, to the maximum extent possible, work from home or other telework procedures, all consistent with our resolution. That in response, number 3, to the COVID-19 emergency to promote secure safety and protection of Mississippi residents, and in consideration of the orders, rules, requests, and other actions of federal authorities, it is vital to maintain continuity of operations of critical infrastructure that essential businesses, which are here and after defined, or operations providing essential services or functions remain open, operational, and continue to provide uninterrupted essential services and functions during this COVID-19 state of emergency. Accordingly, under A, pursuant to Mississippi Code annotated 331511 C4 and 331531, any essential business or operation, and those are in caps because they're later defined, providing essential services or functions may operate at such level as necessary to provide such essential services or functions and shall not be subject to any 10-person gathering limitation or any other limitation or restriction inconsistent with this executive order, but shall take all reasonable measures to ensure compliance with the CDC and Mississippi Department of Health recommendations and guidances to prevent the spread of COVID-19, including but not limited to social distancing, sending sick employees home, and actively encouraging sick employees to stay home, separating and sending home employees who appear to have respiratory illness symptoms. And then the next section cites a number of the statutes upon which the governor relies and says any order, rule, regulation, or action by any governing body, agency, or political subdivision of the state that imposes any additional freedom of movement or social distancing limitations on essential business or operation, restricts scope of services or hours of operation of any essential business or operation, or which will or might in any way conflict with or impede the purpose of this order, is suspended and unenforceable during this COVID-19 state of emergency. However, nothing in this executive order shall in any way alter or modify the authority of the Mississippi Emergency Management Agency, Mississippi Department of Public Safety, or of the State Department of Health and the State Health Officer. So that's what raised the question in our heads: was there anything in ours that's inconsistent? And I think we found that there is very little. I'm not going to read through every section in here, but I will give an example, and it's a rare example of something we find to be inconsistent. There are specific pointing as essential infrastructure, automotive production and suppliers, or automotive sales. And that question's been asked. It's specifically considered an essential service. I don't think you could have read ours to say that was an essential service. And so to that extent, we understand that this will preempt in its definition of essential services. I will read on page 4 of that order, essential retail, including all supermarkets, food and beverage stores, food providers, convenience stores, pharmacies, hardware and building materials, gas stations, restaurants, or bars, but only to the extent that, one, not more than 10 people are gathered in such restaurants or bars in a single space at the same time, where individuals are seated or otherwise in close proximity to each other, or two, for curbside pickup, carry out, or delivery for any of those three. What we've said is or two for curbside pickup or delivery. And again, our understanding is the governor's office sees that curbside pickup, carry out, delivery as a floor, and the no more than 10 as a ceiling. We have chosen that floor here, given the density, given the medical advice we've received here in the city, given the number of young people who have traveled all over the place, given the number of retirees in this town. And again, we're one of the densest downtowns. We have 31 bars and restaurants in a 2-block area, and I don't know how many more, but a whole lot more. And so if we had chosen the 10, we're inviting hundreds and hundreds of people to be in that downtown area, which we understand certainly was not,
Right.
The governor was not trying to impose a loosening to that effect. So there will continue to be some reconciliation of essential retail as defined here under the essential terms definitions, I'm sure. And we understood that with our frequently answered questions, that a lot of that is a case by case. We have to look at the resolution. And I think the governor's office has pulled these from different lists or from CDC information as to what should be essential and what is non-essential. And I don't think we are inconsistent with that, and hardly any of what we've done. And to the extent we are, the mayor has the power, I think, to make that case-by-case call, that if we're inconsistent, we will be consistent with the preemptive listing of essential businesses by the government. Is that?
I think that's exactly right. And the governor was kind enough to go through our resolutions, comparing them to his executive order with me. And he stated that the essential retail would include supermarkets, food and beverage stores, food providers, convenience stores, pharmacies, hardware, building materials, gas stations, and then restaurants and bars for curbside pickup, carry out, and delivery are the essential businesses that they would preempt us. They would supersede us on if we tried to close any of those. But other than that, we can be stricter, just we cannot eliminate any of those businesses. We talked about, there may be a need for stricter measures at some point in time. The governor stated that a curfew would be allowed as long as the curfew did not prevent perhaps supermarket workers from getting to work. So I believe that our first interpretation and reading of the governor's order yesterday, like everything else, conversations just really help us find good solutions. And so I'm very grateful that he was willing to have a conversation that allows us now, board, to not make changes to our resolution. They will stand as we have passed them. So we will continue in Oxford to have the curbside pickup, delivery, or takeout or drive-through options from all of our restaurants. Our retailers, as has been stated before, are welcome to do curbside service, as many have already done that. I know our package stores are doing curbside pickup. So nothing changes as far as the resolutions that this board has in place. I would love, since we have Dr. Waller here, just to kind of get an update of where we are, what we're seeing in Oxford, and tell us where we are.
Yeah, thank you. Thanks for having me, Mayor.
Absolutely.
First of all, I wanted to thank all of you for your swift action on Sunday night to help protect the health and well-being of this community. I think that was absolutely necessary to take those measures. I know a lot of people may think that that's overreacting, but as we've heard Dr. Anthony Fauci, the country's leading expert on this topic, say, if you feel like you're overreacting, then you're doing exactly the right thing this time. So what we're seeing right now, we're still on the upswing of this disease. As you know, it's very contagious, and really this is our best effort to try to mitigate spread as a social distancing, rigorous hygiene, and as far as in this area right now, we still are on the upswing. We started seeing cases. I think our first confirmed case was a week ago.
Right.
And we are on the upswing. You've seen the curves on TV. And some of the computer models that I've looked at, just specifically for Oxford, say that the next, we will peak in 4 to 5 weeks. And that peak will depend on how well, this community practices these measures of social distancing and hygiene. So right now, there are several drugs that are being looked at to treat this, but this is a new virus. It's only been around for about 3 months, so there aren't any large studies on how to treat this. There are some promising treatments out there, but largely just supportive care. The biggest, as the old adage goes, an ounce of prevention is worth a pound of cure. So this is our ounce of prevention is staying away from other people, practicing social distancing, and keeping our hands clean and staying away from people that are sick. Right now, I think as of late last night, we had tested about 58 people at the hospital. 46 of those had come back negative. We had 6 positives, and there were 6 that were still pending. And now those are not all people from our community. We have a lot of people that come here from other counties, and those are go back to their county once they're tested positive. So for those numbers, as far as what you see on the Mississippi State Department of Health. So I think we're going to continue to see the numbers rise in our area for the next couple of weeks, hopefully peak and then go down, but all that depends on how well we manage this. So flatten the curve, as they say. So.
Absolutely. And we appreciate all the work that you're doing on the front lines and for always being so open and honest with us about where we are and stepping in to advise us. I greatly appreciate that. I spoke with Dr. Jeff Dennis this afternoon as well, and he had wanted to come to the meeting, but was covered up with folks in line to be tested. Spoke with Stephanie Barrett at Oxford Urgent Care earlier today, and she indicated that they had around 20 people tested, didn't have any results back yet from that clinic. So I do believe that certainly we're starting to see more tests available and more testing going on in our community. I know that we had reports of 2 Ole Miss students who are here in Oxford that both self-reported yesterday that they had tested positive. And so I reiterate to students, you are not immune to this. And gathering and having parties and that kind of thing is one way for this to spread so quickly. So we encourage people to really be diligent. The future of your community depends upon it. And Dr. Jeff Dennis said when we visited a week or so ago when y'all were here, this may be the most important thing you ever do as a member of this community, is distance yourself to help protect other people. So I thought that was pretty powerful. Okay, so board, I don't believe, I'll not be recommending any changes as I had planned to do to our resolutions in place. Does anybody have any questions or comments regarding our resolution in place or anything else?
Glad we don't have to make any changes. I think our resolution met the need.
I do too, Dr. Antonello. I think it's important, and as we have gotten feedback from our business community and from our citizens, it has been amazingly positive. Even from businesses who are scared to death and closing their doors but want to protect their employees and want to do what's right for the community. So we have found our community to be very supportive of these quick actions. So thank you to our board for making those hard decisions.
Hey, Mayor.
Yeah.
Could you or Dr. Waller elaborate just a little bit on the testing about whether or not, you can't understand, but about whether or not you're tested and the urgent care that goes to a private lab and one that goes to the state and the time difference in trying to get these results back?
Right, I can answer that, or try to answer that. It really varies from office to office, urgent care to clinic. Depends on what lab they're using. I know the state health department, it seems to be, at least anecdotally, taking a little bit longer there. Some of the private labs have picked up their turnaround time. I can speak For the hospital, we use a lab called AEL, and I think some of the other clinics in town use that same reference lab. They're actually running those tests as of this past Friday in Memphis, and they can run about 4,000 a day. And what we're seeing just this week is about a 24 to 36 hour turnaround time on those test results. So the ones that I'm seeing are the positives. I'm not seeing all the negatives. That's followed by our infection control person at the hospital, but I've heard that it's a similar turnaround time for those that are negative, that have come back negative too.
We had,
Well, Dr. Waller, does that mean that I mean, I hate to flood these people, these places with it, but if we know of a place that we can get a quicker result, that's where you should go to be tested.
Well, and that's what we struggle with. We were just meeting about this at lunch today at the hospital. We're following the Mississippi State guidelines and the CDC guidelines on who to test, and those guidelines are constantly changing. Just 2 days ago, the Mississippi State Department of Health revised their guidelines on who should be tested. Obviously, first of all, we want to test the sickest people, and then the high-risk individuals, which they've expanded that to be, people in nursing homes. That's a big public health issue. If one person in a nursing home gets it, that could be a disaster. As we've seen in Washington State, dialysis patients that have to go to dialysis 3 days a week, if one of them gets it, they're going to spread it to the entire community, and those patients are already chronically ill. So those, and then some of the high-risk individuals. So at this point, I don't think we can just flood the labs with everyone, that has a sniffle. Most of these people are going to get better just with symptomatic treatment, staying at home and staying away from other people for 14 days if they do have the symptoms. And in fact, they weren't recommending that everyone that has symptoms get tested. I know from an epidemiological standpoint, it would be great if we could test everyone in the county to see the actual prevalence. There are some reports of people having this that really don't even have any symptoms, and they obviously can spread that throughout the community, particularly our young people, less symptomatic, maybe just a little runny nose. We have a lot of pollen right now. A lot of people have runny noses, so that is a concern. But there is, which I'm sure you've seen in the news, a new test, a rapid test that takes about 45 minutes that hopefully will be approved soon. We've also discussed that. There are concerns about testing supplies and supply chain to actually do that test in broad scope across the country. If that were a possibility, then I think we open up the testing, to a lot more people. But like I said, this is changing almost on a daily basis as far as, who we can test, the capabilities of the labs. People are actively working on that to try to ramp up the testing. So I certainly think that that's important, but we're just kind of having to take it one day at a time.
anybody else have any questions? Comments?
Thank you, Dr. Waller.
Thank you.
Well, I appreciate you all being available, and again, appreciate the governor for working with us this afternoon to keep our resolutions in place. It's important that each of these communities be able to make hard decisions, and he relayed his support of the decisions that we have made, and that he would like to find ways to work together to solve this problem. So we thank Governor Reeves again for that, and with that, I'll ask for a motion to adjourn.
So moved.
And second, all in favor? Any opposed? All right, thank you. Meeting stands adjourned.